So today's topic is micromineral iron. Okay. Those who have the textbook, please mention the page number in the chat box. I don't have a textbook with me right now. In the new textbook, it's page number 231. So if anyone is joining late, help them out with the page number or the topic name. So iron, your body always contains at least 2.5 to 4 gram of iron any time of the day. Okay. This is the average buildup of iron that a human body will always have. And iron is considered as a trace mineral, which means you don't require it in huge amounts. Okay. Like, let's say, for example, calcium. Okay. Thousand microgram on a daily basis you will require. Okay. That is the amount of calcium you will require. So, but as compared to that, iron hardly 20 microgram based on your age and all. Okay, if you're a woman, if you're a pregnant woman, 27 microgram. Okay, so it's a very minute amount of iron that we require on a daily basis. So that's the reason why it is considered as a trace mineral. Okay, or micro mineral. Okay, even though that iron is considered as a trace mineral, okay, the amount of iron that we require is more than other trace minerals. Okay, for example, let's say selenium and all. Okay, hardly 2 microgram or 4 microgram per day you will require, but iron definitely more than 15 or around 20 microgram on an average you will require. Okay, as compared to other micro minerals, iron we slightly require in a higher rate. Okay, because it's the absorption quality of iron. Okay, absorption factors of iron is very low. Okay, the way how iron gets absorbed, there are so many forces working against iron absorption. Okay, so that's why you require iron a little bit more as compared to other microminerals. Okay, other trace nutrients just like irons we require in very tiny amount: nickel, silicon, vanadium, cobalt, selenium. Okay, so those are other trace minerals which we require in very small amounts. But iron, again, it's a trace mineral based on the amount that we consume on a daily basis, but still it is slightly higher as compared to other trace minerals. Am I audible to all? Is my voice clear? Am I audible? Is my voice clear now? Just give me a moment, 1 minute. So again, iron, it is a mineral that your body requires for growth and development. And also there are many uses of iron in your body, okay, like hemoglobin, to make hemoglobin, proteins that are in our red blood cells, okay, making myoglobin to provide oxygen to the body. And there are, and also to make some hormones, iron is required. We will see the functions in detail. Okay. So distribution of iron. How does your is my screen visible? Am I audible? Is the voice clear now? Am I audible now? Is my voice clear? So coming to the distribution of iron, okay, this is how roughly how your body stores it, okay, approximately around 4 grams of iron your body stores every time, okay. So how is this 4 to 5 grams of iron distributed in different parts of your body, okay. So the maximum number of iron is in your hemoglobin, that's your blood in your blood, okay. 60 to 70% of iron is in your hemoglobin. Hemoglobin is that pigment that gives that red color to your blood, okay. That's a red blood cell. It's found in the red blood cell, hemoglobin, okay. 15 to 30% is stored in your liver and also in your reticuloendothelial system. RE system means reticuloendothelial system. RE system is involved in red blood cell production. Okay, the way how your body makes RBCs, red blood cells, reticular endothelial system is involved in that. So your bone marrow, your spleen, okay, they all come under reticular endothelial system. So liver and spleen and bone marrow, they also store iron, 15 to 30% of it. Okay, then 4% of iron is in your muscles in the form of myoglobin. Okay, myoglobin, that's a protein it's a form of protein. Iron in a form of protein is present in the muscles. And 0.1% of iron is in your blood as transferrin, okay, because the iron that you absorb from your intestine, that has to reach different places in your body, right? So transferrin is a carrier protein that will carry iron, okay, from point A to point B, okay. So transferrin also has iron. 0.1% of iron in your body is always present in transferrin. So this is how the iron is distributed in your body. Coming to the functions of iron, transport and storage of oxygen, as we have discussed earlier, okay. Hemoglobin, okay, hemoglobin has heme and globin, okay. Heme part of the hemoglobin is what carries your oxygen, okay. That is the part, heme part is what to which oxygen ions attach themselves to. Okay, so without heme part, heme is made up of iron. Okay, so without the heme part, oxygen cannot get attached to your red blood cells. Okay, so for transport and storage of oxygen, to store oxygen in your blood and to put them into different parts wherever oxygen is required, iron is required. Okay, the main function of iron in your body is to transport of oxygen, production of hemoglobin. Okay, it's a cofactor of various enzymes and proteins. Okay, iron is involved in a lot of enzymatic reactions. Some of that is mentioned in your textbook. You can read that later. Okay, so for enzymes to break down protein, okay, or certain enzymes to form new form of proteins, presence of iron is required. Cofactor means the presence of iron helps this reaction to take place smoothly. Okay. So the presence of iron is important in certain enzymatic reactions in your body. Okay. There are different enzymes. Some of them are mentioned in the textbook. You can read that later. Then formation of red blood cells. Iron plays a very important role in the formation of red blood cells. If your iron stores are low, you will not form enough RBCs. You will be anemic. Okay. Am I audible to all? Is there any issues in the voice? Am I audible to all? So, in formation of red blood cells, iron is required. If the iron stores go down, okay, your bone marrow will not be, because bone marrow also stores iron. Apart from iron, it also stores vitamin B12, copper, okay, vitamin C. These all are required for RBC formation. But the main part here is the presence of iron. So without iron, you will not be able to produce enough RBCs. If you don't produce enough RBCs, you become anemic. Okay, less than normal amount number of RBC in your body, in your blood, it means you are anemic. Okay. So here you can see formation of red blood cells in just a very simple way I will explain. Okay. So those who are from the non-medical background, when you see a blast like this, like hemocytoblast, proerythroblast, early erythroblast, normoblast, okay, when anything ends with a blast, it means it's a cell, but it is an immature cell. Okay. So this erythro means red. Okay. Blast means immature. So this is an immature red blood cells. Maturity is still on the way. It is taking place in your bone marrow. Okay. So these all are enzymatic reactions that are taking place in the bone marrow. You don't have to study about this in detail. Understand, in bone marrow in different phases, phase 1, phase 2, phase 3. Okay. In different phases, your red blood cell is getting matured. Okay. In phase 1, it is a ribosome synthesis. Okay. The DNA, RNA formation is taking place in your RBC. Okay. In phase 2, hemoglobin accumulation takes place. So here, if the iron stores are low, hemoglobin accumulation will not take place. Okay. For hemoglobin accumulation to take place, iron should be present because heme means iron. Okay. So iron has to be present for this accumulation, this phase 2 to take place. If you don't have enough iron stores, very less number of RBC maturation will have phase 2. Okay. And in phase 2, hemoglobin, the red blood cell is getting the hemoglobin. Okay. Still it is immature. In phase 3, the nucleus of the RBC is removed. Okay. So RBC is one cell, one type of cell in your blood that does not have a nucleus. Your white blood cells has nucleus. Okay. But RBC, red blood cells, they are denucleated cells. They don't have a nucleus. They are just basic cells without nucleus. Okay. So they usually cannot produce energy. Okay. So nucleus is not present in your RBC. So nucleus, but while it was getting matured, when maturation stages was ongoing, nucleus was there, but then the cells have to remove the nucleus during their maturation phase. Okay. Then uh, they will be ejected out of the bone marrow. They will be inside your blood circulation in the form of reticulocyte. Okay. So reticulocyte has to stay in your blood circulation for at least 2 days. 24 to 48 hours, reticulocyte has to move in your blood circulation. Only then it can become an mature erythrocyte. So even when your bone marrows are releasing the red blood cells, they're releasing immature red blood cells, which have to gain maturity by staying in the blood circulation for 1 or 2 days. Only then they become a mature RBC. Okay. So this is the formation of RBC. In different steps of formation, copper is required, vitamin C, vitamin B12. Okay. B complex is required. The other, so, but right now we are discussing about iron. So we will focus more on the iron's requirement in formation of RBC. So in phase 2, this is where iron is necessary, absolutely necessary. If you don't have enough iron stores, the remaining part will not take place. Phase 3 will not happen. Okay. And if phase 3 does not happen, bone marrows cannot release immature cells into the bloodstream. Is it clear to all? Formation of RBC? Just the basic understanding of how red blood cells are made in your body. and how iron is an integral part of this formation. Coming to the absorption. So there are a lot of complex ways in which iron absorption takes place. Okay, iron is absorbed in your system in a specific format, in a specific way. Not every forms of iron could lead to iron absorption. Okay, so from the food, the iron that you get, remember, okay, just 5%, 3 to 5% of the iron that you consume is getting absorbed. The entirety of around 90% of the iron that you get from your food is going to leave your body as it is without being absorbed. Okay. Only 3 to 5% of the dietary iron absorption takes place. And usually it is the absorption takes place in your intestine, enterocyte cell, either in your duodenum or in your upper jejunum, okay, of the small intestine. And if you consume a Western diet, 7 microgram of iron per 1000 kilocalories is available. Okay. But only even from that, only 1 or 2 microgram can be absorbed daily. Just imagine how much iron we are losing on a daily basis. Whatever iron we are having, three-fourth of it, we are losing it. Hardly one fourth of the iron consumption is going to be absorbed in your system. So also it is consumed, the iron which is present in your food, it is in the ferrous form, okay, Fe, 3 plus you see, okay, 3 plus, so it is in the ferrous form in complex food. Okay, and in this ferrous form your intestine, it usually won't absorb. It has to be converted into another form which just has 2 ions, okay, 2 plus if you see here. Okay, so it has to get converted into this 2 plus before it enters your intestine. And again, in the intestine, once it is in the intestine, the iron is in the intestine, it has converted into the Fe2 plus. From 3 plus, it converts into Fe2 plus. Okay, only then it will enter your intestine. Okay, and in intestine, you have a protein called ferritin. Okay, and am I audible? Now, is my screen visible now? So, once the iron-based food, it enters your intestine, okay, it will get inside the enterocytes, that is one cell of your intestine, and there ferritin is present, okay. Ferritin are the blocks which can store iron, okay. So, and but your intestine cannot store iron for a long run. It has to release iron into the bloodstream. Okay. So through ferroportin is a channel that you have in your intestine. Only through the ferroportin, your iron can exit your intestine and enter directly into the blood circulation. Okay. Again, in the blood circulation, iron cannot exist in the ferrous form. It has to bind itself to a protein called transferrin. Transferrin, okay? It transports iron. Ferrin means iron. So it transports iron. So again, everywhere the iron goes, it is not alone at all. There are certain proteins and channels always binding the iron. So it can reach one from point A to point B. Okay. And when it reaches its destination, again, iron cannot exist in its free form because that will cause inflammation. Okay, so iron, once it is in the blood circulation, it is in the transferrin form. Transferrin is a protein that helps, that will bind with these iron molecules and transport it through the blood circulation till wherever its destination is. Let's say its destination is liver. Okay, even in liver, iron cannot exist in its true natural form. In liver also, it requires the same ferritin which was there in the intestine. The same ferritin protein molecules are present in the liver that will attach to the iron molecule and store this iron in the liver. Okay, the iron that you have in the liver is sufficient for you for the next 6 months. Okay, without being anemic, the iron stores, if you have good iron stores in your liver, even if in your diet the iron consumption rate goes down, you will not become anemic immediately. For the next 6 months, you are sorted, you are safe. Okay. And even in your spleen, if you see here, this is your spleen. In spleen, also, we have the same ferritin. Okay. Iron is stored in the same ferritin form. Okay. So, this is how the absorption and the transportation of iron takes place. Is it clear to all? And you can see the arrow that goes here comes out also. It's a two-way arrow, which means what? Constantly your body is going through the ups and downs of iron stores. Some days it's too high, some days it's too low. Okay, when it is too high, the iron will leave the storage areas like your liver, spleen, myoglobin, get out of your intestine, okay, and leave your body through the fecal matter. Okay, but when the iron stores are too low, maximum iron absorption is what your body focuses on so that you don't become anemic in the future. Okay, is it clear to all the absorption scenario? Is it clear to all? So for iron absorption and transportation to take place, you require these various channel proteins in form of ferritin, ferroportin, transferrin. These things are required, okay, for iron absorption, storage, and transport to successfully happen in your body. These protein channels are required. Is it clear to all? So metabolism, how iron leaves your body. So on a daily basis, approximately 11 microgram of iron is lost. As I mentioned earlier, the iron that you consume, majority of them that is lost, and a minor segment of it is only absorbed. Okay, so on a daily basis, you will definitely be losing approximately around 11 microgram of iron. If you are having a balanced diet, 11 microgram of iron approximately a man or a female will lose. Okay. Females will lose a slightly lesser amount because every month women lose 28 microgram of iron during their menstruation. Every time they have a period, every period. Okay. Women lose around 28 microgram of iron. That is their menstrual loss in form of blood, the membrane that is shedding, the tissue, endometrial tissue that is shedding. Okay, in that form, 28 microgram of iron is lost every month. Okay, then we have this process called as desquamation. Desquamation means what? If you have noticed in winter seasons, your skin get dry and flaky. You scratch on that dry area, you will see the flakes coming off of your skin. Okay, your skin is shedding that flakes, and you will see it in the atmosphere. You can see the shedded. If you're removing your trousers or removing some tight clothes and you have a dry skin, you can see the dry flakes of skin. The white flakes of the skin is attached on that clothing that you are wearing. Okay, you just like a dandruff. Okay, your skin also behaves like it has a dandruff. It's that flaky dry skin, that is called desquamation or skin peeling. Okay. Even when you do this chemical peels, if you're aware of cosmetic treatments in which chemical peels are used, okay, after doing a peeling within 2 3 days, you will see your skin, the upper epidermal layer of your skin, it is peeling out. Okay, that is also a desquamation. Okay, you can peel your skin out. Women or men, whoever has done certain acne treatment, skin chemical peeling acne treatment, okay, or skin enhancement procedures in which chemical peels were used. Okay, it takes 1 week for you to completely shed that uh, old surface of skin. That is also desquamation. Okay, so in that process, you are losing around 1 microgram of iron. Okay, your skin also, from the skin also, you can lose your iron in the form of skin peeling. Okay, is it clear to all? So iron balance. How does the body make an iron balance, since it is such a tricky micronutrient? Okay, we should obviously have some inbuilt mechanism in your body that is vigilant about iron loss. Okay, so one way of it is reutilization and catabolize of from the catabolized RBCs. How long do you think an RBC can survive? What is the lifespan of a red blood cell? Does anyone know? How many days a red blood cell can survive? Yeah, roughly 3 months or 120 days. Okay, about 120 days, your red blood cells can survive. After that, what happens? Red blood cells will still, even if it has done its work of giving oxygen, now it is old, weary, okay, uh, it still has iron, right? And the body knows it. Even though this is an old RBC, but it still has iron, which is such a tricky mineral. We are not absorbing it enough. So we can't let go of RBC as it is. So what does the body do? The old worn out RBCs, they come to the spleen during the blood circulation. In the spleen, they get catabolized. Catabolized means they are the old RBCs get broken down, and from that broken down RBCs, your spleen is able to manage to collect all the heme part of it, the iron part of it. It will keep the iron part of it, and whatever remains back, that is thrown out. Okay, this is how the spleen helps to collect heme, collect iron from the old RBCs when it is getting catabolized, when it is getting broken down. Because your spleen has to destroy the RBCs, old RBCs, scavenge all the iron from it, and whatever remains will be thrown out of the spleen. It will come out of your body through feces, old RBCs and all. Okay. So that is how we reutilize the iron. So this is an inbuilt mechanism in your body that prevents you from depleting your iron stores. Okay, your body is smart enough to take up the iron from wherever it can, and what is not necessary to shut it off. Okay. Then there is an upper limit cessation in absorption. For example, if you're having a iron rich diet on a daily basis, you have enough iron stores in your liver, you have iron stores in your spleen, you are not at all anemic. Okay, your blood has enough amount of transferrin, your body has enough amount of ferritin levels. Okay, so you are not at all depleting your iron source at all. Okay, but continuously you're eating a lot of iron rich food. Okay, the intake of iron is too high in your food, so intestine knows when to stop absorbing iron before it reaches a toxicity level. Okay, in a healthy way, how to prevent our body from going into a toxicity level of iron. So that is upper limit cessation in absorption. There is an upper limit. Okay, if the iron stores are completely full, we don't require any more iron, your intestine will stop. Okay, it ceases to absorb any more iron. Okay, that is another way of balance. Then you have the ferritin. Ferritin, as I mentioned, these are proteins that are present in your intestine, in your blood, in your liver. Okay, so ferritin, the more ferritin you have, it means the more is the iron stores. Okay, so if the iron molecules keep coming, ferritin is able to collect them and keep it within itself without causing any toxicity level in your blood. Okay, so coming to the types of iron, there is heme iron and non-heme iron. Okay, based on the types of food. Okay, two types of iron can be found in food, heme and non-heme. So heme iron is the natural form and it is easily absorbed. But from where do you get heme iron? It is found only in animal products like meat, fish, poultry. Okay, you will not find heme iron in any vegetarian sources. Okay, heme iron is only found in non-vegetarian sources. It's in its natural form, and the iron from non-vegetarian sources are the ones that is easily absorbed from your intestine. Okay, it is the most bioavailable iron, which means your intestine can absorb it as much as possible without wasting it from the food. Okay, it is easy on your stomach. Okay, taken with or without food, it is not affected by the stomach acid. When you eat any non-vegetarian food, the stomach acid, hydrochloric acid, does not affect the iron content of the non-vegetarian sources. Okay, and it's a natural, non-genetically modified organism is the best organism for heme iron. Okay, some plants are genetically modified, some animals are genetically modified just to fit into the human food production. Okay, and even the non-genetically modified organisms that are those are the best sources of heme iron. The only thing that can inhibit heme iron absorption is if you are consuming a calcium rich diet at the same time. For example, if you're having your breakfast has calcium more than 300 microgram in that particular meal. And if you're eating iron rich food also, that will not allow the absorption of iron. Only if the calcium content of your meal is more than 300. Okay. At the same time, when you're consuming both iron rich food and calcium rich food at the same time, but calcium rich also, it means calcium content should be more than 300 mg. Okay. So coming to non-heme iron, and heme iron is absorbed with a better efficiency. Non-heme iron, it should be first converted into an absorbable form in your intestine. Okay, that is the F2 plus form. If you remember, that has to be converted into that form. And it has, well, if you are using a non-heme supplements, okay, iron supplements are being used and you're using a non-heme supplements, it will have a lot of side effects. Okay, and if you take it on empty stomach, non-heme iron supplement, if you're taking on empty stomach, it will give you a lot of side effects, nausea, vomiting. Okay. And it requires an acidic environment for absorption, like your hydrochloric acid in your stomach, or vitamin C rich food, juices. Okay. If that you're taking, it can enhance the absorption of non-heme iron. So certain environment is required for its absorption. Okay. And if you're using antacids, like if you have acidity, you are using antacids to release your acidity, and then you're taking the iron supplements, non-heme iron supplements, it will not absorb. Antacids will not allow the iron absorption. Okay. Synthetic iron salts, okay, they all are the sources of it. And there are many factors that can prevent the absorption of non-heme supplement or non-heme source of food. A calcium rich food, even if the calcium content is around 150 microgram or more, that can also significantly reduce the absorption of iron. Okay, having this non-heme iron with milk, coffee, tea, wine, chocolate, okay, cheese, that is too much of oily food, green leafy vegetables, okay, yogurts, beans, whole grains, these all can affect the consumption, the absorption of non-heme supplementation of iron. Okay, so it's a very difficult situation for non-heme iron to be absorbed and utilized in your body. So enhanced absorption factors. What are the factors that leads to enhanced absorption of iron? Okay, which can enhance the iron absorption. So increased acidity. If your stomach is acidic, like you have enough secretion of hydrochloric acid, and you are taking some citrus fruit juice along with iron-rich food, you are having consuming enough amount of um, citric acid based food, or lactic acid based food, or tartaric acid based food, along with iron absorption. Like for example, tamarind. Okay, tamarind has imli. Okay, tamarind has tartaric acid, and tamarind is also a good source of iron. Okay, it is a naturally good source of iron, and it also has tartaric acid. So it is acidic in nature, and it also supports the absorption of iron. Okay, so acidic environment allows more iron absorption. Yeah, non-heme iron is found in plant-based diet. Then animal tissue protein, as I mentioned, heme iron is found in animal tissue protein. Do you think milk is a tissue protein? Milk is also an animal product. Egg is also an animal product. But do you think it is a tissue protein? No, it is not. Okay. Like meat is a tissue protein. Organ meats, any form of meat is a tissue protein. Okay. Eggs and milk, they are not tissue protein. They are definitely proteins, but not tissue protein. Okay. So the presence of animal tissue protein can enhance the absorption of iron. So that's why non-vegetarian sources of iron are better absorbed as compared to vegetarian sources. Then body needs. If you are deficient in iron, your intestine will be vigilant enough to absorb as much as iron as possible from your diet. Okay. That's a natural way. Then you have lactoferrin, lactalbumin. Okay, the presence of lactoferrin, lactalbumin, which is present in human breast milk. Okay, human breast milk has good quantity amount of lactoferrins and lactalbumins. Okay, so that enhances the absorption of iron. So that's why even in children who are whose weaning diet has started after 6 months, okay, you have started their weaning diet, and along with that, breastfeeding is ongoing till the age of 2. Lactoferrin, lactalbumin is present in breast milk. That enhances, that helps the child to absorb as much as iron as possible from the weaning diet that the child is having. Okay. Then calcium. Calcium less than 150 microgram, 100 microgram can enhance the absorption of iron. But if the calcium is more than 150 or 300 in animal tissue protein, if calcium is too much more than 300 microgram, it will not allow the absorption of iron. But in plant-based diet, very low form amount of calcium, not more than 100 microgram, it can enhance the absorption of iron because they use the same channels to get inside the intestine. Okay. Coming to inhibiting factors, what prevents iron absorption? Low gastric acidity. If your stomach is not producing enough hydrochloric acid, okay, like for example, during peptic ulcers or any gastric bypass surgery has been done, there is scarring on your stomach in the lining of your stomach. You don't have a healthy mucus lining of your stomach. So in these situations, the acidic secretion of your stomach reduces. Okay, so that will inhibit the iron absorption. Then increased gastric motility, which means too much of fiber in your diet, too much of fiber in your diet, that and also diarrhea. If you're undergoing diarrhea, your gastric motility is high. Your intestine is moving at a very high speed. And if you are using a lot of fiber supplements or too much of fiber in your diet, that also increases your gastric motility because it can relieve you from constipation. But you will lose a lot of iron because intestines require patience and a lot of time to work with iron-based food for absorption. If it does not, if the gastric motility is too high, it does not have enough time to sit and absorb iron. You will lose the iron that you had from your diet as it is. Phytates and oxalates. These are anti-nutrients. Okay. Phytates and oxalates are present in green leafy vegetables, cereals, grains. Okay. Husked grains and cereals. Bran, wheat bran, rice bran. Okay, they all have phytates, oxalates. Okay, so what happens is iron will react with phytates and oxalates, and it will produce ferrous oxalate, ferrous phytate, which are precipitates. Okay, they will not be absorbed by the intestine. That they will leave the intestine through the fecal matter as it is. So that is what phytates and oxalates will do. Okay, they will bind with the iron and they will make an insoluble substance. A precipitate means what? It will not be soluble. Okay, it will not be soluble. It will be an insoluble hard substance and it will leave the intestine as it is without getting broken down. So, and phytates and oxalates are anti-nutrients that will not allow iron absorption. Then polyphenols, which are found in tea, coffee, banana leaf. Okay, they all have a lot of polyphenols. So that will also inhibit the iron absorption. Minerals like calcium, too much of calcium in the diet. Then infection, whenever the body is undergoing any systemic or local infection, absorption rate falls down. Non-tissue protein, because like milk and all, they are very high in calcium. Okay. So that will inhibit the absorption of iron. It will inhibit the iron absorption. So overload of iron, if there is toxicity of iron, what happens? Hemochromatosis. That's one disease condition. A normal liver and a liver that has too much of iron store. As we have mentioned earlier, ferritin is a protein which is supposed to store iron within them in the liver. But what happens when the iron quantity overpowers the ferritin levels? Okay, there are not enough ferritin available to store iron, but your body still has a lot of iron in the blood circulation. So this additional iron will be deposited in the surface cell surface of the liver. Okay. And as I mentioned earlier, if ferritin is not there, the ferrous form of iron will trigger and cause inflammation. Okay. It is an harmful mineral. Okay. It will create a lot of problems. So iron will be deposited as it is without being inside the ferritin protein. Okay. And this deposition will lead to a lot of inflammation, swelling, scarring of the liver tissue. That is what leads to hemochromatosis, too much of iron. And people who work in iron ores and all, okay, this mining, people who are miners and all, they're exposed to a lot of iron dust under the ground. Okay. So this iron dust, they breathe it in. Okay. If they're not using goggles or eyewear, it will go and deposit in their eyes. Okay. The iron that they are breathing in, or when they are, like, if they're mouth breathers, they are swallowing the iron dust as well. Okay. So it leads to iron toxicity in their body. And wherever possible, the blood will go and deposit this additional iron molecules. It can also, your blood can also deposit it in your eyes. Okay. The pupil color changes. Your eyes will have a rusty appearance because of this accumulation of uh, iron ore dust. That is too small. It's a powder, but you breathe it in, you swallow it in, working in that environment. Okay. Occupational safety protocols were not followed. Okay. So people suffer from this disease condition. So coming to RDA, those who have the textbook, you can put the table number or page number. RDA, that's a table 12.3. Recommended daily allowances. So for women, questions related to a pregnant woman's iron requirement, lactating women's iron requirement, teenage girls, adolescent girls iron requirement. These things are important. Okay. And what are the best sources of iron? Iron-rich food, organ meat like liver, kidney, okay, spleen, of any non-vegetarian meat, animal tissue protein. Then coming to vegetarian sources, dates, ragi, dry raisins, black raisins, if you know, okay, drash that are black in color, certain cereals and pulses, green leafy vegetables. So these are rich in iron. Okay. So deficiency of iron would lead to anemia. Iron and even other nutritional deficiencies could lead to anemia. Okay. Uh, Too much of blood loss in menstruation. If it is a child who is suffering from parasitic infections like hookworm infection, to tapeworm infection, okay, they also suffer from anemia. People who have chronic kidney diseases, hypothyroidism, endocrine abnormalities, okay, bodies unable to uh, use iron, which is, even if it is stored, it is not able to use that iron for medical reasons, not able to absorb iron. If gastrostomy has been done or gastrectomy has to be done, a part of the intestine has been removed. In such cases, iron absorption will not be possible. Okay, so these are the leading causes of anemia. So treatment of anemia, nutritional anemia, we will discuss that in detail. Recently, we have took a class on nutritional anemia as well. Okay, just here we are just briefing out the uh, situation of anemia. Okay, so eating a proper, well-balanced diet and vegetables that are rich in iron include spinach, carrots, radish, beetroots, tomatoes, potatoes, green leafy vegetables, fruits like apples, bananas, pomegranate, sapota, that is chiku. Okay. Iron supplements are taken only under medical advice. Okay. When you are being diagnosed as anemic, your physician will give you the best form of iron, which is easy on your stomach, which has low signs and symptoms. Because the current generation's iron supplements, it's very easy on the stomach. Okay. And in some severe cases of anemia, you may require blood transfusion as well. Okay. Usually, you have lost a lot of blood, some hemorrhage or internal hemorrhage has happened. That could also put you in the situation of anemia. In such situation, blood transfusion is required. Then symptoms of anemia: weakness, fatigue, shortness of breath, giddiness, headache, increased heartbeat, pale, dry skin, mood is irritated. Okay, so these are the symptoms of anemia. And even this low BP, especially in women, okay, they sit and if they stand up immediately, they will feel a giddiness. Okay, that's a symptom of anemia. Dark under eye, black under eye, that is also a symptom of anemia in women. So how do you diagnose if you're anemic or not? Blood test has to be done. Okay, it's the only way to diagnose anemia, blood test. RBC count is checked. Okay, or a complete blood picture test can be done. Hemoglobin test can be done. Some other forms of invasive forms of diagnosis, in which you will take a biopsy of your bone marrow to see what is the average iron storage capacity of your bone marrow or your body. Okay, biopsy of a liver tissue, bone marrow tissue can be done just to see what is the capacity of iron storage capacity of these organs. So causes of iron deficiency in different age groups, there are different reasons. Okay, when the needs increase because you are reaching your puberty or you're menstruating, you start menstruation. If a woman is pregnant, a lactating woman, cancer patients, okay, naturally there is an increased need in their day-to-day life of increased need of iron. If they're not able to keep up with this increased demand, naturally they will slip into anemia. Then insufficient intake, vegan diet, limited diet like liquid diet, clear food diet, okay, keto diet. So in which there is a lot of limitations and restrictions in what you can eat and what you cannot. That's a limited diet, okay. So in that you can have deficiency. Malnutrition, any form of malnutrition. Then decreased absorption, you are having enough iron, but you are not able to absorb it. So high gastric pH, which means alkaline, okay, it is more towards alkaline, it is not acidic. Okay, any bariatric surgery, that is cutting a portion of your stomach to reduce your weight, so these are bariatric surgery. Vitamin C deficiency could also lead to iron deficiency. So clinical findings: those who are anemic, we have found them to be immunocompetent, which means they will get infections very easily. Okay, they will fall sick very easily. Their immunity is not that strong. Okay, especially among children, always getting sick. Every 2 weeks they get sick. Then diminished work performance, even in school and even at work. Your focus is not that alert. Okay, you feel very tired and fatigued. You don't socialize much. You don't take part in extracurricular activities. You're always tired, lazy. Okay, so that is diminished work performance. Then cognitive development in children is affected. Children are very irritated. Iron deficient children are like, they will tend to always create issues in the class, always irritated, mood swings. They will throw a lot of tantrums in class. Behavioral implications, the same. Okay, very agitated. Okay, they don't have attention. It feels like an ADHD child. You're dealing with an ADHD child. Attention deficit, hypersensitivity. hyperactivity disorder, that is ADHD. Okay, so children behave like that. Structural and function of skin epithelial tissue. Skin looks very pale, dry. Okay, your epithelial cell tissue also becomes dry, keratinized. Okay, it will not. The cell turnover rate is also very low in iron deficiency. These are the diagnosis of different laboratory diagnosis of iron deficiency. Normal range and anemia observation is seen. So serum ferritin level, serum iron level, serum transferritin level, if it is decreasing, if it is lower than this normal range, it means you are anemic. Okay. So treatment to treat anemia, supplements are used, oral administration, that is iron supplements are used, ferrous sulfate, 50 to 200 mg, depending on your age. If it is a child whom you are giving or infant, 50 mg can be given. 200 mg and all is given for severe anemia cases, okay? And 100 mg is given to pregnant women on a daily basis they have to take. So based on your age and what physiology you are undergoing through, that depicts what kind of prescription you will require. And we have a lot of prevention strategy, the National Anemia Control Program. So under prevention, you have dietary improvement. Okay, you have to guide the public, your community, among which diet they have to focus more, which millets they have to add more. Okay, how to enhance the iron intake in the day-to-day diet, life. For example, cooking in cast iron vessels and all. Okay. Supplementation encourage the people, if even if they get free medicines, okay, from PHC, from government schools, free of cost, these iron supplements are distributed. And what is the normal tendency of people? If something is free of cost, they will not value it, they will not use it. Okay, so encourage them to use the supplementation benefits and eat that. Okay, follow through with the supplementation. Then fortification, we have a double fortified salt these days. Okay, iron and iodine fortified salt, like Tata. You can see this Tata salt, which is red in color. Okay, it's not like the normal Tata salt pack. So Tata salt, which is red in color, it is double fortified, iron plus iodine fortified. So fortification of various food, even the food which the government chooses to fortify is such that it can reach every individual. If you're a vegan and if you're using soy milk, almond milk, okay, packaged one, not if you're not the ones you make at home. Okay, if you're using packaged milk, to go for the ones that are fortified with calcium, vitamin D, iron. Okay, a lot of food uh, manufacturing departments are fortifying their atta, oil, salt, garam masalas, different forms of masalas. These things are getting fortified with iron. Then educating the general public, especially at a clinical basis, uh, gynecologists and obstetricians, they play an important role. Okay, from teenage onwards, a lot of girls visit gynecologist for period related issues, PCOD issues. Okay, so these are the target groups you can catch on. Okay, women who have a child who is less than 5 year old, all the under 5 mothers, when they come to a pediatric hospital, these are also a target population. So catch these target population and educate them regarding the importance of iron supplementation, iron in diet, okay, iron fortified food. Okay, these kind of education has to be given to the target population. So that's about micromineral iron. If you have any queries, you can mention in the chat box.